Welcome back to Made to Behold. Today we're going to talk about surviving cold and flu season, how not to get sick, what to do if you do get sick, and when to see a healthcare provider. Stay tuned. Made to Behold is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Behold. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information contained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing. Okay, this is Krista Michener. Welcome back. We're going to talk today about health, especially around the holidays. A lot of people come out of Christmas or Thanksgiving sick, and everybody blames it on being around other people and their germs. But there's a lot more to it than that. And prevention is really key. So if you decide just to take care of your health around the holidays, it's not going to stick as well as if it's a foundation in your life. Addressing those pillars of healing year round and having a solid foundation, because things that really hijack our health over the holidays, um, first of all, sleep deprivation. I think a lot of people are overextended. They have too many commitments. They're trying to take care of kids and family, and they just don't sleep enough. And sleep is really, really critical to immune function. There's a lot of things your immune system can do while you're sleeping that it can't do while you're awake. So sleep deprivation kind of sets the stage along with stress. And I know when I think back to when I was in school, it was almost inevitable at the end of every semester after finals, I would get sick. And I think it was just because you have those 2 weeks headed up where you're staying up too late, binge studying, and you're completely stressed and you're not taking care of yourself. It finishes and your body's collapse. You didn't take time to rest, so your body's forcing you to take that time. So you really, really, if you want to stay well, need to not neglect your health, because there's so many things to do. You need to pick and choose the things that are the most important and prioritize sleep. If you have difficulty sleeping, and it's not something that's just completely unmanageable, there are supplements that you can use on a as needed basis for sleep. Melatonin is good for some people. Benadryl is great for some people if your issue's falling asleep, especially if you have a lot of kind of anxiety. Benadryl, because it is anti-inflammatory, it's an antihistamine for some of my anxious patients. It's actually really helpful for sleep. You could take, if you're an adult, most adults can take either one or two over-the-counter Benadryl. They're 25 milligram tablets or capsules, so you can take 20 to 50 milligrams safely for most people. Melatonin, I prefer the bilayer melatonins that have immediate and long release. If you're someone who has trouble falling and staying asleep, that's a good thing. Something you want to avoid that really interferes with sleep. Alcohol, yes, it can relax you and help you fall asleep, but it doesn't facilitate good sleep. I think that poor diet around the holidays definitely can also be a hit on your immune system and make you more vulnerable to illness. There's all those delicious treats, and, depending on your health status in your body, you might be able to partake of those in moderation, but you can't neglect your nutrient rich foods. You can't neglect regular meals and your vegetables and proteins and all of those things. And you want to really avoid drinking calories. I mean, have your glass of eggnog, but you shouldn't be chugging eggnog and punching alcohol and whatever delicious things, your peppermint hot chocolate all the time. If you're drinking a lot of sugar and a lot of calories, that's going to be negative. And then there is increased exposure. We're around people that we aren't always around. We're exposed to new bugs. And the only way to avoid that is to not be human and not socialize. And I don't think that's very good for your health. So your best strategy is to focus on the things you have control over. Now, when we look at prevention, there are some supplements that I really like. I've mentioned before allicin, Allicin, which is the medicinally potent part of garlic extract. Allicin has excellent antiviral, antibacterial, antifungal properties. I really attribute it to our family not dealing with acute illnesses much at all the past few years now that everybody's taking it regularly. If you're taking it just as a preventative, you could just take 1 or 2 daily and see what that does for you. There are a lot of different brands out there. We do have available on our website the Zang brand, which is the most potent one out there. There are other ones that are less odorous, but a little less potent, so pick your poison. Another supplement that I love is Viracid, Viracid from Orthomolecular, and they also make Virakid, which is chewable for kids. So it's a combination of nutrients and botanical extracts that can help provide support for your immune system. Some of the ingredients that boost immune defenses are L-lysine, which is antiviral, vitamins A and C, pantothenic acid, which is B5, B12, and zinc. And then it also has these botanicals like black elderberry, astragalus, echinacea, and agraphis. And they all have excellent benefits. So you can take Viracid or Virakid daily, but then if you become sick, you can up it and take it multiple times a day. And I'm going to put on the show notes a link to the fact sheet about it that goes through some of the research, what the ingredients are, because Orthomolecular has great products. They have a lot of research behind it, and I love their transparency with all of that. The only downer about that is Orthomolecular doesn't allow internet sales. And we are going to do private label through them next year, and we'll be able to sell these under our own label. But in the short term, if it's something you're interested in and you don't have someone near you who sells orthomolecular, you can call our office, which is 330-804-7000, and Brandon or David can get you hooked up and we could get some sent off to you. If you need help with sleep, in addition to the Benadryl or melatonin, if those don't work. There's also something called Best Rest formula that we have on our web store that's got a combination of different things, valerian root, the melatonin, just a whole bunch of things together to support sleep. The third thing I would do supplement-wise, though, as far as prevention, is a really good saline nasal spray, especially if you can find one that has silver in it. And ACS nasal spray, theirs is just fantastic. I use it fall, winter. I do a squirt in each nostril twice a day. If you think about what illnesses do people tend to have, sometimes there's the stomach stuff, but most of the time it starts with a cold or a sinus infection. And so, you're breathing in through your nose. Any bugs there can colonize really easily in those nasal passages and in the sinuses. If you're using the ADCS nasal spray or something similar, it's serving two functions. First of all, it's helping to flush some of that out. And then the silver component has fantastic antibacterial, antiviral. That one, and I apologize for all of the mumbo jumbo. We're in the process of getting our online store to carry as many different things as we can that we recommend. We have some places that don't allow internet sales, that have strict policies about things. So everything's in transit. So forgive me if I am sending you multiple different places. But if you're not able to find that elsewhere, if you go to our website, there's a link to Doctor Supplement Store. They carry it. And if you go there and look at protocols, I'm going to have a list for immune support. And you can look at things there. And we're going to have a coupon code, Healthy Holidays. That'll give you 10% off that order. What do you do when you get sick? Hopefully you avoid it. But if it hits, what do you do? First of all, as I mentioned, you can increase the doses of some of the other things you're taking. You can increase the Viracid or Virakid and be taking that multiple times a day. You can, and because the blend of things like vitamin A and some of the other components, they interfere with viral replication. So that's why boosting those during an acute illness is safe. You don't want to take higher doses of vitamin A all the time because it's a fat soluble vitamin. So if you were doing multiple times a day long term, you could end up with some toxicity eventually, but it's certainly fine during an acute illness to really boost that. You can increase your Allison dose. If you're doing 1 a day, you can do 2 a day. If you're doing 2 a day, you can do 3 a day. There's no problem at all with doing that. Another supplement I really like is oil of oregano. It has great antibacterial benefits. Another thing I would recommend if you get sick is to do the opposite of what most of us were taught to do growing up. If you get a fever, don't suppress the fever. Now, if it's high, if you've got like 104 temperature, then it's fine if it doesn't pass on its own to take something. If you have a fever, that's your immune system trying to deal with the threat, and that heat that's induced is a really important immune response. So if you have a fever, especially a low grade one, just go to bed. Let it pass. Let it pass. You can cool yourself off, but don't say, "Oh my gosh, I've got a fever. I've got to take Tylenol or Advil until I don't have a fever anymore." No, the fever is a healthy immune response. So I really recommend letting fevers pass unless they are at a dangerous level and prolonged. The next thing to do is just to rest. If you're sick, your body needs sleep. Sleep. Most of the time, by resting, you will get better much more quickly. You'll be more productive when you are awake, and you'll be less grouchy and nicer to be around. When to seek help? 80% of sinus infections are viral. So, most of the time, if you have early symptoms of a sinus infection, you're going to be better off doing the viral support, increasing the nasal spray. And you can even you can get it from any pharmacy, from the dollar store, just nasal saline that you occlude one nostril and you're squirting and snorting, trying to flush out that sinus cavity because the discomfort comes from the gunk. Anytime we say itis, so sinus, itis, bronchitis, tonsillitis, the itis suffix just means inflammation. So anything to reduce inflammation, but then to clear out anything that's in the way is going to be really helpful. Now, if your snot turns green, that is more likely bacterial. Or if you're coughing and you've got this productive white cough, just some like white, clear sputum, then you're probably fine. But if it gets green or bloody, then that would be the time to get medical attention. If you start wheezing, so wheezing, normally you should take a big breath and the air flows freely. But if it's like a squeak and you feel like you're having a really hard time getting things out, then that would be a good time to go because an inhaler or some albuterol breathing treatments might help. A lot of times, what happens with pneumonia and some of these persistent respiratory infections is you have a scenario where there's all this gunk that your body can't get out because your airways are either constricted or they're smaller because of inflammation. So you need to keep that airway open. You can take stuff to kill, but if you can't get it up and you can't get good airflow, you're not going to get better. Certainly, if you're short of breath at rest, I would completely go get help. If you have a persistent high fever, if you're 104 for a couple of days or if you get over that, certainly you need to be seen to see what's going on. Where do you go when you're sick? That's a great question, especially over the holidays when people are booked. I know we're booked solid for the rest of the month. I've reserved some time if we have acute needs that we can squeeze people in. And then you get the unfortunate situation sometimes of getting sick on the evening of Christmas Eve and everything's closed, or, the holiday goes over the weekend. So you've got a couple of options. A lot of insurance companies now, if you carry insurance, do have telehealth options that are more for kind of like an online urgent care almost. So I would check with your insurance company because that's become pretty common and that's cost effective and it's not going to require you to go out and be exposed to more sick people. I mean, one of the bummers about going to an urgent care, especially the emergency room, is you're going to be exposed to a bunch of sick people. So reserve the emergency room for actual emergencies. They're completely slammed. Their job is to make sure you're not dying and then send you on your way. You're not going to get very satisfying answers from an ER. An ER is a great place to go if you have a bone sticking out of your body or you can't stop bleeding, or if you truly are like short of breath and can't get to an urgent care, your primary care is closed. Certainly there are scenarios. Heart attacks and strokes would be good ones where you go to the ER, but most of the time it's really not going to be your best option. Your best option is to either find, if you can't get in with your primary, like telehealth through urgent care that operates like an urgent care, or to find an urgent care center because they really are set up to manage acute needs that aren't life-threatening. So the sorts of things that hit us over the weekends, you can usually get lab work done there too. A lot of urgent cares do x-rays, there are a lot of different options for that. It also, though, is a great illustration of why it's really good to have a primary care provider and have a good relationship with them, because if you get into a pinch, then you have some place to go. So I had a patient come here for the first time earlier this year, had some really severe respiratory problems, ended up in the ER, wasn't getting better. They said, "You need to go back to your primary care provider." He went and made an appointment, and they actually even checked him into the appointment before they said, "Oh, we can't see you because you haven't been here for 3 years and you're like a new patient." I don't quite know why they couldn't do that, but a lot of practices, if you have not been are not up to date on appointments, will treat you as a new patient, and then it's harder to get in. Having a relationship with someone before you get sick can save you a lot of trouble because then you have someone to advocate for you. A little story about my family's health woes because we have a lot of interesting ones. My poor husband, the week before Thanksgiving, was having some chest discomfort with breathing. We did an EKG, it was normal. He had some elevated inflammatory markers, and everything was pretty consistent with what's called pericarditis, which is inflammation around the heart. We started treating him for that. There was some improvement. We had done a chest X-ray and they didn't send us the results, and we had to hassle them. We eventually got them, and the left lower lobe of his lung is collapsed. What are the risk factors for that? Smoking, he doesn't smoke. Recent surgery, he hasn't had recent surgery. I mean, you just go down the list, he doesn't really hit any of the boxes. So we ordered a chest CT. And I know this is what a lot of you are up against, so this is why I'm telling this story. Well, we sent the order to one hospital and they said, your insurance doesn't really like to approve things in December. You might as well just go to the ER. And I'm like, no, I'm not going to the ER. I don't like the ER. I'm ethically opposed to going to the ER when I have other ways to deal with this. So we were able to reach out to another hospital who's willing to get him in. He's having his chest CT and chest ultrasound tomorrow. But point being, having a primary care provider who can advocate for you and call around and say, this is ridiculous. And by the way, my nurse was able to get it approved pretty quickly because it's kind of a no brainer. You have an abnormal chest x ray. Now, I know not everyone is like fortunate enough to have medical training to be able to judge, is this an emergency or if this isn't. But if you have someone in your court, you're much less likely to have to use the ER unnecessarily, because if we went to the ER, yeah, he would have gotten the chest CT, but then they would have just said, follow up with your primary care provider. He would have been around all sorts of sick people. We would have had an ER copay, and it was just unnecessary. So maybe when we're talking about New Year's resolutions, and we talked about this last week, maybe a good New Year's resolution is if you don't have a primary care provider, to find someone this year who you trust, who you can work with and have a relationship with, and can, if you're feeling sick, instead of hoping it goes away or waiting until you feel like you're dying, you can go in early and they can order a chest x-ray or do blood work or listen and say, no, I think you're good. Let's just do this instead. So those resources are really, really important. Another thing to recognize when you go to medical appointments is try to be organized and try to be targeted with what you hope to accomplish in an appointment. So I'm spoiled in my practice now because I work outside of insurance. I'm not stuck with these 10-minute visits, 15-minute visits that are typical in the healthcare world. That's one of, I guess, the privileges of working this way. And I am sympathetic to why most providers operate that way because they could not, with what insurance reimburses, afford to function if they gave 45-minute appointments to everyone. They wouldn't be able to pay their staff and pay, nursing, billing, scheduling, all of these people. It really is a survival thing. Most people aren't I mean, there are a lot of greedy people out there, but most people aren't greedy, and most primary care providers are not getting rich. A lot of them struggle to break even. That's why you see so many primary care practices being bought up by these big hospital systems because financially, the hospital system can absorb a primary care practice that's not making a ton of money because it's offset with some of their specialty services and imaging that are higher priced and some of them very overcharged. So it is really difficult in the context of primary care for someone who's working with an insurance system to be able to afford to give longer appointments. So when you go in knowing that, you have to have a very targeted idea of what you want to accomplish. Most people will have time to adequately address one or two things in that 10 to 15-minute slot. So even if you like to visit, and I like to visit, you probably want to cut the chit chat, say, these are the things that are bothering me the most. This is what I've already tried. This is how it affected me. Give a targeted history, and that way you're just gonna be able to get the most out of that visit. If you have a lot of things, it's gonna have to take up another visit, and again, it's not because most people don't want to spend more time with you, it's just the way our healthcare system is structured. And that's why I'll dive a little into insurance. When I started my practice, I really struggled because I wanted to be able to take care of everyone. I wanted to be able in my previous job, I had a lot of Medicaid patients. I really enjoyed taking care of that population. We have in our area a lot of people who aren't insured and a lot of people who don't participate in your traditional healthcare system. But I realized you can't have a practice that serves everyone. It's just not possible because of so many regulatory issues. I can't if I accept insurance, I can't give discounts to patients if I want to because I can't charge anyone less than what I charge the insurance company, even though the insurance company is not going to pay me what I charge them because you have to give the insurance company benefits. I mean, it's just all of these sick little twisted things that make it really, really difficult. If you're in a position to find a provider who does things a little differently, in some parts of the country, direct primary care is really taking off. We actually tried that model for a while, but it didn't take off here like we thought it would. So, what direct primary care is, it's different than concierge medicine, even though there's some overlap. Direct primary care, you pay a monthly membership fee. And in most practices, you then just have access to that practice. So, you're paying your monthly membership fee, which but for the most part, they try to price it so it's not super high, and the idea is that you're probably gonna have most of the months of the year that you don't need seen, but say you're really sick and you need seen every week for a month, it's not gonna cost you anymore because you're a member. It's almost like joining a gym. So direct primary care is a really great option, even if you have insurance, but you have a high deductible plan, which I'm pretty sure is almost everyone. Direct primary care providers, because they don't work for insurance companies, have a lot more flexibility and time. They tend to limit the size of their practice. So the abbreviation for that is DPC. And you can search online for like DPC provider near me. There are some national virtual direct primary care practices too that will help with like coordinating your yearly labs and check-ins, sick visits, if you have meds you take routinely. They can help with refills. I worked for Bowtie Medical for a while. They're a national virtual primary care practice, and they do a really great job. They've really created a great option for people to have access to quality care. And direct primary care practices also typically do negotiation with laboratories, sometimes pharmacies, where they can get you discounted services if you don't have insurance that covers that piece of things. So this year, if you don't have a healthcare provider that you really trust, get that in your pocket. It's going to be hard to establish a relationship with someone new and have that all working in cold and flu season. Sometimes it takes a while to get in as a new patient. But search, look for reviews, look outside the box, look for people who do things a little differently because they are going to be more flexible in what they do and going to be able to individualize your care and help you get well and stay well. So, in summary, first of all, don't get sick. Take care of yourself, get enough sleep, say no to things, don't eat a garbage diet. Take some antiviral supplements, Allicin, Viricid. Protecting those nasal cavities is huge with some saline or saline and silver nasal spray. And if you do get sick, listen to your body and take a break. That's what it's telling you. It's saying, I can't do this anymore. I need to rest. Go ahead and rest. And remember to always have hope because you were made to be whole. Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686.
Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.